So in last class, we were discussing related to all the basics, key how we are going to transfer the patient, what all protocols we are going to follow, and how what all things being as a part of healthcare administration, what all things we need to take care. Okay, all these topics we have already discussed in last class. Okay, remaining things were like all those things which we are going to discuss today is the second part or the remaining part of that particular condition. Okay, am I audible, guys?
Yes, ma'am.
Okay, so any doubt from the last class? Abhishek was there till end. Abhishek, any doubt? No. Okay, so we discuss till hospital management, certain patient care services we discuss. Key, what is the admission or discharge things, what all things we need to take care. Okay, during types of admission is directly from, like in hospitals we have two categories of conditions which we encountered every day. One is your outpatient, another is your inpatient, and third category is your emergency services. Okay, so emergency services may be taken care at emergency only, or sometimes it will turn into your IP conditions, inpatient. So from ER to IP. Okay, so these are the basic three conditions which we encountered every day to day in our life when we are taking care of patients into an hospital setup. Okay, in clinical setup we only encountered OP cases on majority or daycare cases. Okay, so these are the things which we encountered. Okay, so there are certain protocols. If we are transferring any patient from OP to IPD, or IPD to from emergency to IPD, I can see there is a certain protocol. Okay, when we are processing this, I can say especially the insurance cases. Okay, like if you had patient encountered into OP and then he entered into IP, unplanned IPs or planned IPs. So what happens? When you claim as a patient to the insurance company, they will not consider. Why they will not consider? For them, if they check into their system, inpatient and outpatient will be overlapping on same day. So we will not consider such conditions. In that scenario, again, we need to escalate that thing. Okay, the IP admission was after OP consultation as per the OP consultant, then they will consider and ask the documents and then they proceed. That's why being an administrative, we need to understand every flaws. Okay, that's the reason why I am telling all these things to you. Okay, so when you're processing all these kind of cases, first thing is the basic, where we need to encounter the insurance services, we will need to have a basic understanding, क्योंकि वो OP को OP consider करते हैं, but IP और OP एक साथ होता है, so they will not consider. In that scenario, we need to tell कि patient was initially encountered, first encounter was at OPD, and from OPD we transfer that patient, or that patient is turned into inpatient treatment. Okay, so then first thing I tell you what all protocols we need to keep in mind when we are discussing related to admission. Second thing is receptions or the members, what is the nature and behavior of the members who is taking care of these patients, what all protocols they need to follow as a part of administrative services. So second thing we discussed related to all these things. Third thing, if someone is coming to the hospital, they feel a sense of home care because the patient is already in state of depression and anything. So whatever the things, they should be taken care in a very I can say delicate manner, or a very emotional, or everything they require. So being a part of again a healthcare administrative, we need to be a supportive one and understand what is the psychological state of that person and how we need to take care of them. So again, the receptionist, the our sisters, RMOs, or RMOs, they have to be work accordingly, or what was every have to be work according to the need of that particular patient. Because I can say we are someone who is working on, our industry is totally working on a response basis system. Okay, whatever we cater to our patients, it will definitely fluctuate into the market and give business and return to us. That's why whenever any staff is hired into the hospital, we check what is their initial days, we keep on them provision. Why? Because in order to check them whether this person is giving a positive response to our patient, bringing business to us or not. That's why we are keeping the persons on provision period. Once they clear and we understand, we can keep this person for a longer duration, they will turn into that. So that is the second important thing. Okay, again we take care of their important valuable things as well as their emotions. Okay, so if I talk about nursing responsibilities, so nursing responsibilities, other than understanding the patient needs, they need to be very conscious of what is the line of treatment. That line of treatment should be administered on time. That is the prior responsibility of the nursing staff. Okay, and they should be maintained, that all details on a piece of paper or registers or log. Why? At the bedside of the patient also, and as their nursing station also. Because whenever there is a any kind of shift change, we have all the details. Okay, any kind of emergency, we have all the patient details related to that particular patient on their bed. So doctor or anyone can check or look into that information and get all the details. Okay, earlier when he was admitted, DB was this, respiratory stuff was like this, SpO2 was this, and then we match patient. If we are giving any kind of treatment, whether that vitals or that response to the medicine of the patient is going in an improvement way or in a deterioration. So on the basis of that, we will change the line of treatment. So again, all these information nurses has to maintain. So it will make easy to doctor to handle any kind of emergency. Okay. So these are the basic responsibilities of nurses. If I ask, okay, prepare the unit, like patient where they were staying into the hospital, keeping their bed ready, positions of the bed, ambulatory patients, whatever the positions they are comfortable, we adjust accordingly. Patients on stretcher, so bed should be at the lowest positions. Okay, so all these things we know, okay, their biodata, their date of admissions, essential articles, supplies, they should be taken care, okay, by these nursing staffs. Now, next we discussed if in last class when we are transferring any kind of patient, what all protocols we keep into mind. What is the lift size, whether we need a stretcher, whether we need a wheelchair, what is the mode of transportation, like stretcher is needed, wheelchair is needed, or any additional support is needed, or patient can walk by themselves. So these all things we need to keep in mind whenever we are, until and unless when we are transferring any patient, the new ward, until unless the staff from the new ward has taken fully responsible for that particular patient or not taken the responsibility, till there is the part of the earlier nurse who is taking care, is their job profile to make ensure the patient is comfortable over there in new place or not. Okay, once they will be familiar with the staff and nurses, they can introduce them, these people with that patient, their staff with the patient, and they can come back to their nursing stations. Okay, so this is again, when we are transferring, we need to keep into mind. Okay, in cases of moving patients. And second thing, when we are moving the patient, we keep to mind if the patient is on stretcher, we keep their essentials on that same stretcher. If patient is on wheelchair, if space is there, we will keep on first visit only, otherwise we will make another visit. Okay, next, coming to the purpose of discharge, we have already discussed. We have LAMA, we have DOR, discharge on request, we have abscond, we have transfer to another hospital, and that these are the different types of discharge. Okay, and discharge planning. Okay, so whenever we are doing any kind of discharge, we make a discharge summary. So in that summary, we write what is the main reason why we are discharging this patient, whether they are healthy or they need a higher services. On the basis of that, we write what is the exact type of discharge, and then we elaborate the condition. Okay, so roles of discharge procedures. Nursing care again play a little bit role or very important role in discharge conditions. After this, we have a medical legal cases which we discussed already in last scenarios. Now coming to all patient related services and assistance and good communication. So I told you why the communication is very important, because our industry is basically on response basis. Okay, and second thing is mouth to mouth publicity. Okay, if someone has taken a avail any facility or any services from us and they were happy with those services, they will communicate to the other people into their community ki, oh, there is one new hospital, their services are good, their doctors are good, they are very educated, all these kind of things. That's why our nature, our knowledge, our behavior, and the waste skills, every skills of our staff is going to affect our business. Okay, so in our scenario, we need a good communication skill. Okay, so registration process. Okay, so patient admission services starts with the registration process. When the patient is coming for IPD or OPD, first what they will go into, they will go for registration. Okay, so there they encounter, the first encounter at any hospital of any patient is your registration counter, where they will go and register themselves and get their registration card, either it is OPD or IPD. Okay, next is your medical assessment and trial. In this scenario, what happens ki patient undergo any kind of assessment into the healthcare services, or professionals are going to evaluate their health status prior to their conditions or urgency, whatever the need of the patient, like if they need any cardiac test, if they need any kind of examination, then medical assistance and trials is required. In this scenario, we training nurses or assist the patient to appropriate care areas based on the severity of the condition. Okay, whatever may be the severity of the case, condition, our staff will always there. For example, I told you it's a legal compliance key. For example, if we discuss whenever we are examining any female patient, okay, it's a rule कि we need to be have a someone from the family. If family member is not there, we ask the medical staff or nursing staff, a female medical staff or a female nursing staff should be present at the side of the patient when she was examining by any doctor, that is specifically if he or she is a male. Okay, for that particular condition. Okay, in cases of baby also, we consider the same thing. A member, their family member should be there to assess that particular baby. If they are not there, then we ask someone from the female medical staff or someone who can cater the babies well. Okay, so they should be there when we are examining, okay, to assist. So whenever there is based on the gender, based on the age group, like geriatric and pediatric cases, we need assistance from the medical staff as well as from the family, depending upon the conditions. Okay, next is room and bed assignments. For example, after the medical assessment, patient को आपने assigned assess कर दिया, initial assessments कर दिया, उस time पे जो भी आपके rules and regulations, we followed everything. Next step, what we will do on the basis of urgency, we will transfer that patient into the hospitalization condition. Like IP में हमने उस patient को admit किया. Once we started the admission process, the patient need to assign with a particular bed number, ward number, and everything. So how we again this bed number and ward number is again going to assign by the basis of the criticality of the patient and what kind of treatment he or she is needed. On the basis of that, if it's a general condition, we will provide a general ward. If it is a severe condition, we will provide a severe wards. Okay, again variation is depending upon the departments also. Meanwhile, cardiac condition, we will transfer the patient to the cardiac department or cardiologist. Okay, treating doctor will be cardiologist in these scenarios, and the ward will be cardiology. Okay, so again, basis of that, semi-private. And thirdly, I told you ki what kind of accommodations patients want. Okay, these wards, if I talk about wards, will be like general ward means 6 bed or 12 bed, depending upon every hospital has their own criteria. Then we have private, semi-private, suites, luxury, super luxury, VVIP rooms, like every services depending upon the pocket of the patient and choice of the patient. Okay, if I talk about on the basis of medical necessity, we have CCU, ICUs, and H. Okay, CCU, ICU, and wards. On the basis of medical necessity, we have three categories. That is the wards. Then we have emergencies, CCU, and ICUs. These are the basic, and NICU for babies again. Okay, so these are on the basis of medical necessity, and on the basis of, I can say, patient pocket or something like that. So then we can go for private, semi-private wards, or I can say like rooms. You can say wards or rooms. Then we have this luxury, super luxury, VVIP suites, all these things, whatever the services patient and their pockets allows. Okay, so if the after the medical assessment, the patient assigns to the hospital room or a bed based on the factors such as medical need, bed availability, and patient's preference. I told you in all these scenarios कि हम medically पहले we examine the case, then we will check कि that particular patient को किस department में भेजना है. ठीक है कि आपका cardiac patient है, आपका nephrology का patient है, आपका gastro का patient है, वहां पे एक segregation हो गया. Next segregation कि patient को हमें बेड अवेलेबिलिटी के बेसिस पे कि उसकी कंडीशन कैसी है, आप मेडिकली नेसेसिटी चेक करेंगे कि सीसीयू देना है, आईसीयू देना है, जनरल वार्ड विल वर्क. ओके, then once this category is decided, now the third category, patient preferences comes. They want semi private, private, double sharing, single sharing, or high end services. So lastly, we check for the patient preferences when we have left with certain vacant seats. Okay, so the triage nursing assesses the patient to appropriate care based on the severity of their illness or injury, ensuring the timely treatment for those critical needs. Okay, so whatever our first priority being a medical staff is to care the patient as per their medical need, and secondly, we keep their preferences also in mind for their comfort zone. Okay, once the bed and room is assigned, now we check for the consents for the legal documentation. If we are going to perform any kind of procedures on the patient, okay, so the patient or their legal guardians are presented for the consent form and detail the risk, benefit, and alternatives for the purpose of treatment procedure, and informed consent ensure the patient understand their care and have opportunity to ask the questions or voice concerns. So for example, if we are going to perform any kind of procedures, I don't know how many of you have already worked into the hospital setup. What we will do is we ask the patient to, we explain the procedures to them and ask them to sign a legal consent forms. Okay, these consent forms is like we explain the everything. So their legal guardians are present for the consent form. So for example, depending upon the age, if I talk about कि patient का age, particular age क्या है, on the basis of that, for example, if he or she is not able to take his own decisions, in those scenarios, we ask for the consent forms or legal documentation. So the patient will, the parents will be the one who is taking care, decision on the behalf of that particular patient. We are going to perform this procedure on your child, and these chances to happen if something, might be the positive cons, these are the negative cons, and what all things will happen to that particular, and what is the need of that particular procedure into your patient. Everything will be explained to that patient, and then we will take a consent. If they say yes, okay, I'm okay for this particular thing, then we proceed with that. So there is two categories of consent, I can say. First part is key consent for the treatment. What kind of treatment they want to offer for their patient, like conservative or this surgical procedures. Okay. Second consent is procedural consent. Procedural consent is once they choose their choice, okay, we choose conservative. Okay, fine. If they choose surgical, in that scenario, when we are performing that particular procedure, we take a procedural consent to the patient. Okay, so we ask for the procedural consent. Okay, so there are two different types of consent, and these consents will be considered as a legal documentation. Okay, so legal documentation such as directives or healthcare proxies allows patient to specify their preferences for the medical care in advance and designated or surrogate decision makers. So, for example, in hospitals, when you are hospitalized, I can say those things will be recorded. So if you need to present those conditions to anywhere, like in your offices or any cases, legal cases or somewhere, it will be taken care. Yes, this is a documented thing. This is a recorded by hospital. We will take it as a proof. So your consent will same time become a legal documents also, or your IPD or OPD will also become your legal document. Next is your patient assistance services. So now, earlier we were reading the patient admission services, what all things will be the patient admission services. Now, a second part will be your patient assistance services. So what kind of assistance we need to provide? So for example, we need to help the patient to navigate any kind of navigation into the hospital if they want to reach. So if they have any language barriers, if they have any kind of uh, services they need, like ramps, wheelchair, lifts, anything depending upon their physical needs. Okay, and directional assistance also key to reach any particular position or a geographical area. Okay, next is financial counseling and insurance guiding. So financial counselors helps the patient to understand their healthcare costs, insurance coverage, and payment options. Third is interpreter services. So hospital offers the interpreter services, like where the language barriers are there. For example, I'm coming from any part of North India and treating doctor is from South India, so they need an interpreter. In that scenario, if I'm not able to, we don't have a common language of communication. Okay, again, someone from South Africa coming to us, again we need an interpreter. So in case of language barriers, we need an interpreters. Okay, so maintain the uh oh, okay, next important thing, if we are hiring any kind of interpreter, so that person need to maintain the confidentiality. Okay, so the interpreter, their job profile is to maintain the confidentiality between the doctor, whatever the conversation they are doing, and everything. So we can do in multiple ways. Either we can do through apps, either we can do through video calls, or we can hire a person for that particular communication. Okay, and whatever the communication is going to be done, these services are recorded if we are doing in calls or on phones or in apps. So we are going to record. So again, the confidentiality should be an issue. So as per the HIPAA protocol, the confidentiality should be maintained. So we strictly need to follow that. Okay. Next is support from the service populations, means like specialized service addresses the unique needs of the pediatric patients and the other vulnerable patient population, like pediatric support services may be included into the child with life specialist or play therapies or family centered care approaches or psychiatric cases or geriatric cases. So all these things where the special care should be needed, we will provide that. Okay. So next is clinical services, I can say. Clinical services is like medical consultations and examination. For example, I am admitted into the geriatric department, but meanwhile, my cardiac is not functioning properly, or they perform, or for example, I'll give you one of the best examples, that is the growth hormone. We are giving a growth hormone to a baby. For example, the baby parents are consanguineous, or they are married to their close relatives, I can say. So what happens as a response of that, when the parents are married to the close relatives, as a response of that, they have a negative inbreeding into the baby, and baby is totally affecting with the growth hormone. In that scenario, we are giving a growth hormone to the baby. Okay. Now, any kind of hormone, when we are injecting into the body, it will affect the overall metabolism of the baby. So, when the baby's overall metabolism is going to get affected, in that scenario, what we need to do? We need to check with different doctors. Like being an endocrinologist, I am injecting that particular hormone into the baby of age of 9 or 10 years, but same time I'm going to check with a cardiologist ki my hormone, does it got any bad effect on cardiac services, does it, because regular examination is needed into that scenario. So in this condition we need a medical consultations. Okay, this is a one scenario I discussed. Okay, so patient receives through the evaluation by the medical by providers for the diagnosis condition, develop treatment plans, or monitor the progress. Okay, so once the cardiologist said, he examined the body and the cardiac functioning, and he says, till now I didn't see any kind of bad response. Then we can proceed. Okay, so this is what we are monitoring. Okay, and then we are progressing with the further treatment. Okay, next is your diagnostic procedures like your CT, MRI, X-rays, every diagnostic procedures, like starting with a laboratory test, I can say phlebometry tests with the functionings, or your advanced functioning, I can say that is your advanced diagnostic tools we are using, like CT, MRI. Nowadays we have thermal or infrathermal rays for detection of different kind of disease conditions. So depending upon the need and what kind of functional and what kind of studies we need into that particular patient, and on the basis of that we will proceed diagnostic procedures. Okay, but whatever the techniques we are going to follow, that should be minimally invasive. Okay, nowadays and painless. So that should be very precise and accurate for that particular sign and symptoms or particular disease condition. Okay, so we don't unnecessarily, we don't try to uh, torture the patient with the different types of tests. We will try to do as minimum as possible, being a medical staff. Okay, as per the protocol I'm telling. Okay, next is your treatment modalities. What kind of treatment you are going to provide to that patient based on their diagnosis, past medical history, and their preferences and treatment goals. I told you, na, when patient is coming to and we are going to get signed, there is two categories of treatment. For example, one is for that particular condition, like just take an example of what I can say. Just take an example of I can say a small calculi. We ask the patient to take the medication and take certain dietary controls, and we will re-examine. That is the first category. Second is we can go for a surgery, any kind of laser surgeries. So patient, for example, in this scenario, patient opted ki, no, I don't want to wait, I won't get cured as early as possible. So they opted for the surgery. In this scenario, what we are going to do? On their choices, we perform the surgery. Okay, so surgery is one treatment modality. Okay, in cases of fracture, you can say okay, we go for rehabilitation. So physiotherapy is another modality of treatment. Okay, then we have occupational therapy, we have speech therapy, we have psychotherapies, So these are the different types of therapies I'm telling, chiropractic and all. Okay. And then we have alternative medicines. For example, in India we have homeopathy, we have Ayurveda. Then in China you can go, you have Chinese medicine. So these are the alternative Unani medicine. These are the alternative kind of medicines we have. Okay. So again, a different type of modality. Next is your pain management and palliative care. So pain management is prioritizing the pain or palliative care of the alternative suffering and enhancing the comfort and improve the quality of the life of the patient to cure that particular patient or decrease the intensity of the pain. So we can do with a different modality. First is we can do the pharmacological. Second, we can go for non-pharmacological and interventional therapy. So these are the different types of pain management therapies. First, pharmacological therapies, where what we will do, we prescribe the medicine, patient will treat and pain will subside. Second is non-pharmacological. We will try to cure the root of the pain. Okay, pain initiated due to calculus, we will remove that. Okay, pain initiated with this condition, we will cure this. Okay, due to trauma, we will treat the traumatic condition first. Okay, so that is your non. Next is interventional therapies, means depending on the patient preference, what kind of interventions we can do. Okay, into that particular medical condition. Okay. Next is patient education and empowerment. So this we already discussed, ki patient ka education and empowerment, how we are going to discuss. So very important कि patient को self care education होना चाहिए for the any particular condition. If patient is not aware, for example, I am diagnosed with a diabetic condition, or I am falling into the pre-diabetic condition. If my doctor is good, he will or she will tell me ki, pros and cons of this particular condition. Ki, look, Richa, if you're not going to follow or you're not going to manage your weight, just take a common example into the female, that is your PCOD. Okay, so my gynec told me, if you're not going to follow this diet, if you're not going to lose your weight, if you're not going to do workout, if you're not burning your fat, what happens gradually? Gradually, your condition will deteriorate and turn into infertility. Maybe or may not be. Okay, so she's telling me all pros and cons. It will cause me truncal obesity. It will cause me irregular menstrual cycle, heavy menstrual cycle that will turn into any kind of vaginitis or erosion, ectopic erosion of cervix. So all these conditions she will told me when I was first diagnosed. Now my priority is, again, this is the condition, associated conditions that will happen to me because of PCOD. Now what she asked me, to maintain the diet, to reduce the weight, to do the workout properly, to take the medicine, fluids, everything, and reduce fat and sugar into, especially into the diet. So once she asked me to do, I'm properly doing, I'm working out, and I'm seeing the changes into my body. But if I am not doing, oh, this is a condition, I'll take medicine, I'll get cured, this, if this psychology is there, might be after 5 years, might be my condition will turn into a very different condition. For example, I'm having heavy menstruation with a vaginal infection, candida infection, or yeast infection, any kind of infection because of. So this may be a severity, or maybe in future it will turn into irregulation, will, or any kind of infection will turn into inflammatory, pelvic inflammatory diseases, or any kind of cervical cancer or something. Okay, so this is the severity of one condition turning into multiple severe conditions. Okay, so that's why the healthy literacy program should be very important for the patient, where we provide all education to the patient related to their medical condition, which is already been established. And same time, we are providing them the treatment options and self-care practices. Okay. Next is your disease specific education. For example, that is particularly we do in cases of, nowadays we are doing for cervical cancers, the most common we are doing. Earlier we were doing for tobacco, or in between we were doing for COVID. So that is a disease specific education. Matlab ki COVID, when it is come started as roots into the India, we just discussed and try to explain all the conditions. to key, okay, these are the sign and symptoms. If you encountered any of them, you have to report to the nearest medical hospital, get your test done. Once it is positive, you have to isolate yourself, follow the diet, follow the medicine. If something serious turn or you feel such kind of difficulty, then turn up to the hospitals. So these are the, I can say, disease specific educations we are giving to the patient to reinforce their health or to reinforce the health conditions into particular society or community, or remove the misconceptions. So misconception in case of COVID is related to a lot of vaccines. Okay, so I again, vaccination is done on very short duration of time. So may every vaccine has the chances of replication in any population, okay, or any medicines. So that is again, I can say, a kind of misconceptions. Okay, next is self-care instructions. Self-care instructions is like how we are going to manage our health on our daily basis. So we need to maintain a hygiene, we need to maintain a wound care, medication management, we need to maintain a physical activity recommendations and monitoring of sign and symptoms. So these are self-care instruction. Lastly, we do the lifestyle counseling. Lifestyle counseling means whether we are doing any active living an active lifestyle or we are adopting a sedentary lifestyle. So we ask the patient to change, counsel the patient for changing or adoption of their healthy lifestyles. For example, overall lifestyle counseling nowadays we used to do. Okay, and in this we try to check what is the present lifestyle the patient is living. Once we came to know, okay, they were falling into this category, then we will change their lifestyle. For example, what is their nutritional needs, how much exercise they were doing, what is the stress management therapies they were following, is there requirement of any kind of deleterious or deleterious habits, like I can say they were eating tobacco, or they were smoking, or any kind of abuse to any kind of substance. Okay, so we examine or take the history first, what kind of diet they were taking, every in-depth detailed case history, and then we will encourage them to change their habits, to reduce their smoking, do the smoking cessation. Okay, do the stop using the substance, any kind of abuse they were doing. So substance abuse prevention should be there. Okay, regular exercises should be added into their meditation, should be added into their daycare activities. Okay, and then try a weekly barriers for them. In 1 week you have to come up to this level, next week or next 15 days you have to come up to this level. So gradually we will see the changes into the lifestyle of the patient. So lifestyle encouragement. Next, if I talk about is your psychological or social support services like counseling and mental health services and support group to the peer networks, social work assistance, and spiritual care. And uh, so if I talk about the counseling and mental health services, that is related to the behavioral needs. Okay, once when we are studying into any kind of hospital management, behavioral needs should be discussed always on the priority basis and depth. So for example, patient is when they were into the hospital, or their family members, there are always state of emotional changes. Why it is so? Because every people in case of, it's not the place where we enjoy, na? It's the place when we turn up, we met with any kind of accident, when we are not well. So if something we feel, you know, this is not normal, something is abnormal with the body or my condition, then I turned up to the doctor. So already I'm in state where I'm feeling little bit of depressed or negative or anxiety. In that scenario, when doctor comes with his diagnosis, maybe I will not understand anything ki, oh, doctor said you are having a serious trauma. You will see, oh, maybe if I'm telling any kind of, diagnosis and their treatment procedures and pros and cons of that treatment, patient will feel very negative because they are already in negative. And now I'm telling the negative of the disease condition or negative of the treatment, they will feel, oh, if this happens, maybe this also happens. So this is how their behavior was 90% people behavior into the hospital. Very few are very positive and optimistic in, no, I can fight with this my present medical condition and I'll live a normal life. Very few people, 1 to 5% people can only have this psychological. Otherwise, when we encountered any patient, they were very distressed, suicidal ideations will be there. So on the basis of their psychological health, we need to treat the patient. Okay. Second group, you can see peer pressures, like patients with their parents, when they are coming to the hospitals, they provide, they we can feel they were having, peer to peer network foster pressures. Means like patient coach, especially in childhood, we had a peer to the white collar doctors. Okay. So again, we need to bring them, we need to support them, we need to change their psychological thought process, and we help them to treat. Okay. So the hospital may facilitate the supports the good meetings, online forms, or social events to encourage and participation of, or foster the sense of community among the participation. Okay. So peer-to-peer networks may vary. Means it may vary within the hospital also and outside the hospital also. Okay. So maybe one example I'm telling you, they might be have a fear from a particular doctor or maybe from every doctor. Okay, so we need to work on these conditions wherever it is required. So if I talk about in general, the social support or psychological support should be very important in certain scenarios and in patients. Okay, next is your spiritual care, I can say, or chaplains. Chaplain services means ki whenever any, for example, there are certain scenarios where I don't know the exact community, but in their community, the blood transfusion is not promoted. Okay, because of their religious norms, I can say. So we need to understand and try to counsel the patient. Okay, we understand, but at this time your family member or your patient needs the service, so it is our prime concern to do that and treat the patient also. Okay. Next is your patient safety measures. So whenever we are working in any kind of hospital setup, our first prime concern is to do the patient safety measures like infection control. We need to do fall prevention strategies, medication strategies, and risk management procedures. All these things we need to do. Why we need to follow all these things? To make the patient's life more safer. Next is your communication in the patient care. Means ki when the patient is into your hospitalization, into your I can say area, so what kind of communication you have. So your communication should be always effective, and such kind of words you should pick, or such kind of way of explanation ki everyone should be actively listening you. They should be you more empathetic to have a communication with you. Clear and concise language should be used, and non-verbal communication awareness is very important. Means like gestures, facial expression, because the words can have only 10 to 20%, but your gestures, your facial expression, your personality gives rest of the 90% impact on the patient. When patient entered into the any hospital, they tell the patient doctor their words later or their problems later, but the first impact being a doctor, when I saw a patient, the way he walks, the way he speaks, what is the pitch, what is the intensity, or what is the pain expression on his face, all these things I will be examining. Same way the patient will examine also now. Yo, this doctor is dietitian, but you know, her skin quality is dull. She is dull. She is so dull. She is so lethargic. How can we she diet? Being a dietitian, how can we? She should be like that. But for example, I look like, I had a very good glow. I'm a very charming person. My personality speaks a lot. So, so they will be, already convinced by my look. Yo, this doctor, when she explains, when she walks, now she's so confident. So you can see, especially if you have seen now, in internship we encounter such kind of things. For example, you are treating one patient and your friend is treating another patient. Sometimes you encounter due to your personality, your friend's patient asked or request to the higher management or senior doctors, can I get treated by this doctor? I want to get treated by that doctor. Why so? Because of personality or the way you are working. So they will be impressed by your knowledge or by your personality. Okay. So non-verbal communication play very important role. Next is your interdisciplinary collaborations. Interdisciplinary collaborations means, if I can say, the team communication protocols, the multidisciplinary rounds, and heads of communication procedures. These are within the team and within the hospital community, how we are interacting, being a endocrine department to cardiologist to surgery to gynae to maternity. Obs gynae maternity will be same to a neonatal again. So how we are communicating with each other. If we have a smooth communication between the department or within the department, it has a great impact on our working. Okay. So clear communication protocol should be there to facilitate coordination and information sharing, and communication channels, platforms, and formats are defined and ensure the time and accurate exchange of the patient related information, regular team meetings, hurdles, and debriefing, and promote the open related information. So whenever we are having any kind of information, we can do the open communication and things. Okay. Multidisciplinary rounds and meetings. So we have different round meetings, or healthcare professionals from different fields can come and open and discuss. For example, being ops, can I am performing a surgery, okay, but meanwhile I'm facing my patient is a cardiac patient, so I need a cardiologist also, I need a surgeon also. Okay, so we work together as a team, the result will be more effective. Okay, so in such scenarios in hospitals we have multidisciplinary teams and rounds where the doctors from different specialty come together and treat a one or two or multiple group of people. Okay. Next is hands-off communication procedures. Involves the transferring responsibility of the patient care from one provider to another, ensuring the continuity and safety. For example, ICU से आप वार्ड में शिफ्ट करें, एक कम्युनिटी से दूसरे में कर रहे हैं, तो यहाँ पे हमें सबसे ज्यादा पेशेंट के सिचुएशन एंड वी नीड टू टेक केयर ऑफ द सेफ्टी ऑफ द पेशेंट. Then conflict resolution strategies should be followed. Next is patient provider communication, sharing decision making approaches, health information exchanges, addressing the patient concerns and preferences, and cultural competence in the communication. So these should be the patient provider communication. Provider means doctor and hospital part. Okay, so share the decision making approaches means we should not give a wrong information and confused information to the, whatever the informations we are giving to the patient, we are very sure that this is the exact condition, this is the risk, or this is the benefit of this particular condition. So we should be very clear. Once we are clear with our decision, we will share with the patient. Next is health information exchange. Okay, what should be the exact amount of information should be exchanged between the doctor and patient. Okay, so that is your EMR or EHR records, and to whom we can share, like to family members only. In cases of HIV and all, the status should be disclosed to the patient only, not, that is against the protocol, we cannot even disclose that status to the family member. So as per the protocol, the health information exchange or the EMR records, depending upon the case to case. Okay, to whom we are going to hand over that information. Again, if I talk about RH factor or blood group factors, again it is a subject of matter discussion. That particular case should be disclosed, or that particular report should be always handed over to the particular patient only, not to the family members. In family members only we can give to the spouse. Okay, there are protocols we need to go in depth, okay, related to the health information exchange data. Okay, other than that, there are critical information such as medical changes, care transition, enhanced conditions, and patient safety. So as per the protocol and as per the things, we are not going to share everything. We are going to share the limited set of informations. Next is addressing the patient concerns and preferences. Okay, whatever the concerns they are going to across or encountered with the patient, and patient is going to encounter with the doctor, they will report and we will listen them and try to resolve those particular conditions and satisfy the patient. Okay, next is cultural competence and communication. So whenever we are doing any kind of communication, we should not follow any kind of cultural norms or language or customs. That should be where the patient is more comfortable. Like if we know that particular language, we will try to communicate into that particular language only, and we try to respect their norms of their culture. Okay, but if it is a medical necessity, we will try to convince them to do understand the need of that particular procedure and go for that scenario. Okay, or allow the doctor to perform that particular procedure. Okay, next is family and caregiving communication. So involving the family member into the caregiving decisions means कि आप उनकी family से discuss करेंगे. If the patient is not able to make the decision, then in that scenario family is going to make the decisions. Okay, next is providing the updates and progress reports. Collaborative care planning, ki what we are planning, we are going to engage the family members also, their preferences also, and try to make them to understand what is the priority of that particular condition, how we are going to support that patient, and once the patient is discharged, how they are going to take care of that patient. Okay, meanwhile, whenever we are planning any kind of patient discharge or alignment, we need to take care कि we should promote the values continuity of the care and enhance the support network for the patients and the family. Okay, so these are the basic things कि when we are caregiving to any kind of a patient support or family category. Next is health information technology communications record system. That is your like give what kind of EHR records we are going to see, because that EHR record is a communication for future. Like whosoever is going to take care into the last past medical history. So whatever the information we are going to code on that particular EHR record should be a clear documented things. What is the reason of clinical encounters, what is the plan and line of treatment, and why that plan and line of treatment was given. Okay, and everything should be recorded on real time, exact scenario should be there. There is no, I can say, transcriptions into that or any changes into that particular condition which we are giving to, or whatever the services we are giving to that particular patient, that should be clearly mentioned. Okay, we don't do alterations to those things. Okay, for the benefit of the patient or for the benefit of the particular hospital, we don't give we should not encourage such kind of practices, I can say basically. Okay, so whatever the electronic health records we are going to maintain, that should be very clear. Okay, there is should not be any kind of I can say alterations into those particular department. Okay, next is your patient portals. So the patient portal should be a site where the patient can get access. They can take the informations and make the meetings. So if they need any kind of refills for their medicine, they can come and get the prescriptions for that with their doctor. If they want to book any kind of appointments with their doctor, they can do through these portals. Next is your telemedicine or so consultation facilities. Nowadays, this is, I can say, the virtual care plan or platforms where they can go for checkups, routine checkups, follow visits, or any kind of minor discussions with their doctors over the call. Last is your securing messages and communication channels, where we secure the messages from the different facilities and for future references, and same time to coordinate the care for the patient need. Okay, so these are the different healthcare information technology communication records which we need to take care. Okay, uh, last topic is patient feedback satisfaction. This is key. What is the patient's status, key, whether they are satisfied with our or they need any kind of changes or any improvement is needed. So these kind of things will be mentioned on the form and they will write over there. Or lastly, we have a compliance and grievances, means hospital have a process in place to address any complaint from the patient or any grievance. So they can they are always we are always there to encourage such kind of things. If we have any problems into our channel, they can come and say us, or we are lacking in any kind of facility, or they have any grievances with us, they can come and share it, and we will try to resolve those things, because the communication should be transparent and we empathize with those category of people if we are at a false position, or we are at फ्लॉस कंडीशन, मींस कि हम अगर गलत जगह पे हैं, अपनी तरफ से हमारी तरफ से कोई हॉस्पिटल पार्ट पे वी हैव डन समथिंग रॉन्ग, वी विल ओवरकम. Okay, so then only we can provide a excellent services to the community. Okay, so with this the patient communication all has been covered. Next is your nursing care with full devotion and commitment. So this part we will going to cover in next class. I'll discuss with her, and I'll give, because you people are having exams, so I'll give the pointers, main pointers, because if I'm going to discuss whole of the PPT, it will take too much of time.